A little over 20 years since the dawn of democracy, South Africa projects the image of a country on the move. But it has the largest number of people in the world living with HIV/AIDS, 7 million of them. Yet the disease is no longer a death sentence that it was for previous generations, thanks in part to millions of dollars of US government aid.
You and I slept without condoms, so all your exes are pretty much in our relationship.
One of the great success stories of how that US money is spent is this TV show.
What is the point of this clinic if you can't help me?
You can try the loop contraceptive.
But if the storyline strays into reproductive health or abortion issues, the producers have to look for money elsewhere. It's all about complying with tight US funding rules, and those rules have just got tighter.
Next is the policy in regard to Mexico City.
With the stroke of a pen, President Trump has enacted what's been dubbed the global gag rule. It means that millions of dollars of US money for HIV is potentially at risk if it's linked in any way to abortion.
HIV prevalence in South Africa is high. There's a lot of work that goes towards it, and this is work that we want to continue happening. So I think this is where the main problem is, that we're going to have to choose one, you know? Are we going to choose to keep fighting HIV in the country, or are we going to choose to give women a right that they have according to the Constitution?
Unlike many other countries in Africa, abortion is legal in South Africa. But with high levels of stigma, nearly half of all terminations are done as backstreet abortions.
There's anecdotal evidence that the pills used to induce an abortion are stolen from state hospitals by members of staff, then smuggled out onto the black market. With the introduction of the US rules, there's a fear about a contraction of services here, forcing more women to seek abortions out on the street.
Here in Johannesburg, you don't have to be a detective to discover where to purchase abortion drugs on the black market. We've taken our hidden cameras with an actress posing as a client and arranged a meeting with a man. Watch the character in the dark jacket. He's the dealer.
So you're saying I don't need to go to doctor, no? And it's not going to be, is it painful? Just like your normal period pains. Just like...
He tries to steer her into a shop to hand over the pills.
No, but you can take them out. I understand, but the question is always this stop busting down here. But take it out and then come back.
It then emerges that the man sitting down is in fact his accomplice. They just want to make the sale, so he slips the drugs out from up his sleeve. Then in minutes, the pair are gone. The actress hands us the packet of 5 pills, which she was instructed to take all at once. The cost of the transaction, £30. We took the drugs to an accredited abortion clinic.
So Pilar, these are the pills that we picked up on the street, 500 rand, £30. Are those the right drugs?
Yes, they are the right drugs, but the dosage, no, it's not. We give clients 4 pills, and this being 5 is an overdose.
Campaigners worry that with a shadow cast over funding for all areas of health, including family planning, more unwanted pregnancies and more terminations are inevitable. Botched abortions are one of the biggest causes of maternal death in the world. The new global gag rule is only likely to make that worse, and for HIV/AIDS, which still claims millions of lives each year, there could also be unintended consequences.
Even though I tested HIV positive, I don't think it is a barrier for me not to achieve my goals.
Zandile, an aspiring young businesswoman, owes her survival in part to the billions of US tax dollars pumped into fighting HIV. The US contributes 2/3 of all bilateral funding worldwide.
I come draw blood every 6 months and collect my medication every 3 months.
But the money to keep Zandile healthy now has conditions attached. It cannot be traced to abortion services in any shape or form.
I don't see how people can sit in Washington and think they can then influence me on that micro level. I'm restricted in terms of giving you health information that you have a right to for you to make informed choice. So it interferes with the doctor-patient relationship in a very, very, very negative manner.
The problem with singling out abortion is that modern-day healthcare is all integrated, whether it's children's vaccinations or sexual health. Activists warn they could all be affected by this rule simply because they're on the same site.
With a children's clinic here and reproductive health and HIV services down the corridor, this one-stop shop is the gold standard that international health agencies are trying to promote. But there is a fear that the global gag rule could impose guilt by association for services that have got nothing to do with abortion.
Thousands of miles from here, President Trump's signed into law rules which some view as an assault on South Africa's sovereignty. But turning the country's back on the biggest donor in the world may also be tough. It's a delicate balance.
The taxpayers in the United States have a right, and the healthcare workers in South Africa and the women in South Africa have a right to also attain their highest level of care based on the laws of their country.
Many believe the US is overstepping the mark, threatening to damage sweeping gains made to improving the health of millions of people around the world. Self-sufficiency still beyond the horizons of many African states.